So we have a sample from our patient and we're gonna dip it now. The test strips are very sensitive to air and light, and they will go bad if kept too long in the air, so you will keep your bottle closed most of the time. The test strip has to be entirely submerged in urine, and you can do it just by holding it inside for a few seconds until you're sure it's soaked. And then for convenience of reading and for letting it develop, I usually just lay it down on a clean napkin. I will save my urine just in case we need to do further lab testing with it. According to the manufacturer, you can start reading your results at 30 seconds, and it's good to also record them while you go. And it's all being done basically by comparing colors and matching them to the spot which matches it most. So we have a white spot, which is the ID band, and the next one is our glucose, which looks slightly more blue but is obviously negative. Next one is the bilirubin, which on our strip here looks rather white, but because it's not turning actually brownish tan, it's negative. And the test strips will always be slightly different than the colors shown on the box, as far as I experienced. Then the ketones. Is negative. Specific gravity, which takes a little longer to develop. So we're probably more on the 1.010. Amount of blood in urine, definitely negative. pH, which will, for healthy urine should be kind of lower, is obviously low at 5. Protein looks yellow, where it would turn green the more protein in the urine. So it's negative. Urobilinogen is also a rather yellow color versus the pink that goes on, so that's the lower number. Nitrates. This is an important indicator for infections. Our spot looks white, where it would turn pink with any degree of nitrates present. And leukocyte esterase. appears to be trace. So looking at these results, we don't really see indicators of a urinary tract infection. The main ones to look at would be presence of white blood cells, which is indicated by this one, and some bacteria might cause nitrate to be built in the urine, but that's only sometimes. If the infection has been going on for a while, there might be some protein and some blood in the urine. An infection normally shouldn't show glucose or ketone present, but definitely having glucose in your urine would increase the risk of infection. And sometimes symptoms of burning with urination might be caused by having a very heavy specific gravity for urine when people are very dehydrated and the urine is dark discolorated.